Have you ever wondered if your UTI diagnosis was right? Imagine two people, Sarah and Jane, both with that telltale burning sensation and constant need to pee. They see different doctors, get different tests, and walk out with completely different treatments. Sarah gets antibiotics and feels better in days. Jane gets told it's probably just irritation and is sent home, only to end up with a full-blown kidney infection. What went wrong? The answer lies in how we diagnose UTIs, and it's not as simple as you might think. Let's step into a doctor's shoes. When you bring in a urine sample, the first thing we often do is a dipstick test. It's fast, easy, and gives us a quick snapshot. We're looking for clues, like a detective at a crime scene. Two of the most important clues are nitrites and leukocytes. Now, here's where it gets interesting. Many people think these are a surefire sign of infection, but they're not. Think of them as smoke, not fire. Leukocytes are white blood cells, your body's little soldiers, rushing to fight something. They indicate inflammation, but that could be from an infection, a kidney stone, or even just irritation. And nitrites, well, certain bacteria like E. coli are clever. They convert nitrates, which are normally in your urine, into nitrates. So, if we see nitrites, it's a strong hint that these specific bacteria might be having a party in your bladder. But what if the bacteria causing your trouble don't produce nitrites? The dipstick will come back negative, even if you have an infection. So, the dipstick is just the beginning of the story. If things are still unclear, we move to step 2, looking at the urine under a microscope. This is like getting a closer look at our suspects. We can actually see the bacteria and the white blood cells. This gives us more confidence. We can see if there are lots of bacteria, or just a few. We can see if your body's defense system is in overdrive, but even this has its limits. We can't tell exactly which bacteria we're looking at, or what their weaknesses are. That's why the gold standard, the final chapter in our investigation, is the urine culture. We take your urine sample and try to grow the bacteria in a lab. This takes a couple of days, which is why we don't always do it. But if we can grow them, we can identify the exact culprit and, more importantly, test which antibiotics will actually kill them. This is crucial. It's like knowing the supervillain's name and their specific kryptonite. Now, let's talk about treatment. Why do antibiotics sometimes fail? You might think, I took the pills, why am I not better? Often, it's because we're using the wrong weapon for the fight. If a doctor prescribes a broad-spectrum antibiotic without a culture, it's like dropping a bomb hoping to hit one bad guy. It might work, but it also causes a lot of collateral damage to the good bacteria in your body. And sometimes, it misses the target completely. This is why finishing your full course of antibiotics is so important. Stopping early is like letting a weakened enemy escape, regroup, and come back stronger. It's a very human thing to do. Do you feel better? So you stop. But those last few doses are often what finishes the job for good. Many people also make a common mistake. They chase symptoms with leftover antibiotics. You feel that familiar twinge and reach for the pills you had from last time. It's understandable. You just want relief. But you could be treating the wrong bug, or worse, you might not even have an infection. This self-prescribing is one of the biggest drivers of a global crisis that's making UTIs harder and harder to treat. We're accidentally training these bacteria to become resistant to our best medicines. What happens when the antibiotics stop working altogether? We'll explore that terrifying reality in our next video. Thanks for watching, and don't forget to subscribe for more health insights.